Hello.
Okay, this is the Renal PIQ. Quinn, you're the leader. I'll be the scribe.
We put a D here.
Oh, oopsies, that was me. Sorry.
Alright.
Do you want to start us off?
Yeah, I'll start us
I'll be the
off.
timer.
Cool.
Thank you, Alan.
Let us know every time 7 minutes has passed.
Sure.
Keep us on track, hey, don't laugh at me. 7 minutes is the sweet spot between 5 and 10 minutes.
Okay.
Read
Read the first thing I said.
Alright. So guys, how are we doing this week? Everybody have a good 2 weeks off?
Oh, right, the
We
check-in.
have to do the check-in.
Yep, I had a great 2 weeks in the ER.
Did you have to work
As a
overnight a lot?
patient or
I worked overnight like half the time. No, not as a patient, Alan. Yeah, I saw some fun stuff.
Sweet. I had a great 2 weeks. It wasn't too taxing, and I felt very rested and ready to get back to school.
What did you do?
Oh, I was on internal medicine, and it was cool. We were on the 11th floor of the new hospital building, like a great view out there. And then we got to practice doing histories and physicals on different patients and presenting to the attending, so it was really useful. We got feedback right away, so there's a cool glimpse of like what third year will be like. But it was nice to be able to go home early.
You did?
Yeah.
Nice.
Yeah. How about you, Josh?
Pediatrics, it was fun. Kids are cute.
Thanks. How about you, Jess?
Family med. People are old, and some people are healthy, some people aren't. It was fun. It was good though. I did some healthy exams.
Was it like, oh, you did? Oh, was it like around here, or did you have to travel somewhere? 'Cause
No,
know
I
some
just
people
went.
have to
It
travel.
was near East Campus, like there, mainly the clinic there.
Alan, you did psych, right?
yeah, I was with children. It was interesting.
Psych, like pediatric psych?
Yeah, I was at the BMC in the child floor unit.
Yeah.
It was kind of sad actually.
Yeah. Huh. How about you, Kitty?
It was a good 2 weeks. I did neuro at the VA, a lot of like stroke rehab patients. Yeah, it's pretty good.
Like Mary, I was in the ER, so saw a variety of things.
Nice.
Did stay overnight a couple times.
I'm not jealous of that.
Honestly, it's not that bad. I kind of like the overnight shifts more.
Really?
Yeah.
It's not bad if you have stuff that's going on. I think the peds night was kind of rough just because there wasn't a lot. But,
You're just kind of like sitting there waiting for things to happen.
yeah, or like all the people are there who are going to be there and like we've seen them, we know what's going on, and now it's just kind of waiting for like, okay, they need to go up to the floor or.
Yeah, like waiting for a bed to open up.
Yeah.
Cool. Well, it's good to see all of you again. So I'll start off reading. All right. So you are working with Dr. Wright in his clinic at Loma Linda Clinic. 3 patients are scheduled for the first hour of the clinic. The first 2 patients are seen during the same visit, Mr. Jose Hernandez and Mrs. Maggie Hernandez, who have been married for over 25 years. They both have generally been healthy, with no chronic medical problems, and do not take any medications regularly. 7 weeks ago, Mr. Hernandez began having pain above his belly button that was mild in nature. Over the ensuing 7 weeks, the pain has become more severe and persistent. Over the past 3 weeks, he has also noticed pain significantly worsened with eating, which has caused him to decrease the frequency and size of his meals. He has occasional heartburn and nausea with no vomiting. He usually sleeps well at night. Mr. Hernandez is up to date on his vaccinations and has never taken prescribed antibiotics and has never been hospitalized. He does not drink alcohol or smoke cigarettes, but does use chewing tobacco. He sleeps at least 7 hours a day and eats at home most of the time. He and his wife are vegetarians and cook mainly using an induction stove, crock pot, and instant pot. Mr. Hernandez works as a corrections officer at a local state penitentiary. Mrs. Hernandez was feeling well until 4 weeks ago, when she first developed nausea and heartburn and felt full easily after she started eating. Several days after the nausea and heartburn began, She also developed a burning pain below the xiphoid process. Her lifestyle and diet are similar to Mr. Hernandez. Mrs. Hernandez works for Pentagram, working mainly from home. Other than a cesarean section at age 30 to deliver the Hernandez's only child, she has never been hospitalized and only takes a women's multivitamin on a regular basis. Both of their physical exams show tenderness in between the umbilicus and xiphoid process without radiation. Head, ears, eyes, nose and throat, heart, lung, and skin exams show no abnormal findings. After reviewing your findings with Dr. Wright, he reviews your problems list and differential diagnosis. After listening to your presentation, Dr. Wright provides feedback. He agrees that your top 3 differential diagnosis was reasonable, but he was less certain about Zollinger-Ellison syndrome. Based on your discussion with Dr. Wright, you review your management recommendation for Mrs. and Mr. Hernandez. You suggest that they both undergo an esophagogastroduodenoscopy. You explain that the procedure would involve inserting an intravenous catheter to administer midazolam or propofol, followed by an esophagogastroduodenoscopy. Mrs. Hernandez readily agrees to the procedure, but Mr. Hernandez says he was afraid of needles and refused to undergo the procedure. Dr. Wright says it would take 30 days for the insurance authorization to go through for the procedure. In the meantime, the two were prescribed lansoprazole or ionsoprostol, I can't stop, on a daily basis and aluminum hydroxide on an as-needed basis. Prior to prescribing the medication, you check to make sure that they do not have any kidney problems or problems with constipation. Then we have some charts about abdominal pain.
Which I guess
And
those
so
charts
now-
are just
We have to complete this box before proceeding to the next part. How does lansoprazole affect the kidneys? Oh, someone really did this one already.
Yeah.
Good job, guys. Being efficient. What are some other learning issues?
this isn't a learning issue, but for the schema I put inflammatory, and I don't know if we want to put idiopathic since we don't
It's not really.
know what's actually causing it.
Yeah, for now.
Because we don't know if it's like congenital or toxic or whatever, or
Okay.
infectious.
Can we also put infectious because it's both of them
Could be infected.
Good point.
having the similar thing?
Similar.
Yeah, true. At the same time, it's a little suspicious.
Well, sus. Oh, so it doesn't say that we need to have a certain amount of learning issues, does it?
No.
So I guess whoever put how does aluminum hydroxide affect the kidneys? Oh, or I was just gonna say that we could answer that one.
We could also answer that one.
But
I
also
can do that one.
we can
Yeah.
just
Right.
So what are the differences between them?
Mr. Hernandez is more
lansoprazole
epigastric. Oh wait.
What?
Are you talking about the differences between
Yeah,
the
between
patients?
these two patients.
Oh, between the patients?
Oh,
Like his pain is more epigastric, hers is more subxiphoidal. They both have heartburn and nausea.
isn't?
It's like almost the same
I was
area.
gonna say, isn't epigastric like below the xiphoid?
Okay, well then his would be like
Epigastric.
because
Right,
his
this
is
is
right
where you
above
feel
his
heartburn.
belly
This
button.
is
Guys,
where
I
you feel heartburn, though,
think we've
right?
uncovered our next learning issue.
Yeah.
Okay.
I agree.
Quadrants
Yes.
agree.
of the abdomen.
Yeah. What are the areas?
I guess okay, so his would be like umbilical.
Why do they describe
Technically.
aluminum hydroxide instead of like Tums, for example, like chalk?
Calcium carbonate.
Yeah.
See.
It
Chalk.
doesn't hurt the kidneys as much.
Okay.
Yeah, so hers is more
It works better,
straight
too.
subxiphoidal, whatever you want to call
I don't know if
it.
you can see from over there. but
And-
I
there's,
can't.
Yeah.
His would be more
Totally,
umbilical
you can
because
divide
around
it
the,
into a
I've only
tic-tac-toe with epigastric and then umbilical and then
Calcium
hypogastric.
Is his umbilical?
yeah, his is
Yeah.
umbilical
Oh,
Um,
hers
because
is
it's right above the
epigastric.
belly button.
Okay.
But
It's like,
Oh,
it's
so
fast.
it's not epigastric.
Oh, okay. that's
not
good.
for his. I guess hers could be, or you could
It's like
call it
surrounding this word,
subxiphoid,
he's, like,
whichever.
describing it.
Um,
That's good.
Yeah.
If you-
They have the same accompanying symptoms.
Yeah.
The only
So much
difference
Advil
between
all
the
the
two
time.
is that Mr. Hernandez has like a history of chewing tobacco, and that's like it.
Mhm.
But
Is that like associated with ulcers or anything?
Maybe that causes
Um,
less saliva production, which means that the stomach acid doesn't get neutralized as much, which could give them GERD symptoms.
well, because it says in this chart, upper quadrant epigastric considered cardiac causes, but I don't think she has any cardiac issues. That doesn't seem correct. Anywho's.
Is Zollinger Ellison like that gastronoma thing?
Yeah.
I think it is, right?
Yeah. Yeah, too much gastric acid.
Yeah.
Does it sound to anyone else like they have ulcers?
Oh.
Possibly, but also like I don't know if we want to put that yet because I don't know if we want to actually put that in anywhere because we don't have to give a differential yet.
Like we're getting a little bit too far.
Yeah.
Okay,
We're gonna
good
get more
point.
tests.
Keeping me on. So really, we're just in learning issues,
Yeah.
the problems list.
Are we including what are the areas of the abdomen? Or no? Did you want that picture in there or no?
Yeah, that's why I put it there.
Oh, where
Are
is
you
Was it too much?
No, but where is it?
This one?
Here it is.
We
Did
can
I
just
get
make
rid of
it. No,
somehow?
we can. Yeah,
I
you
was
got
having
rid of
trouble
it.
finding
You just put it
papers
back
that were
in.
from
I didn't
papers
do
that
that.
You
were
literally
like
just
20
put it
years
back
old,
in quick.
but-
Well, I thought it was missing it, but I thought someone else took it out.
No. Okay, we can move on to the next section. Okay.
Inflammatory, idiopathic, infectious. Does anyone else have something else they think it could be? Do we think it could be like cancer?
Well, do we want?
Plastic?
Could be.
I don't know. I feel like
Just
that's
like-
jumping ahead. We don't have anything
Probably,
else
yeah.
to.
Right.
Yeah.
It could be.
But it could
To
be.
rule out how.
Well, and then we had this specific
Doesn't say
mention
how
of
old.
something that it's not.
Let's
He
leave it
was
like that
less
for now.
certain about Zollinger-Ellison syndrome.
Yeah.
So what's that? Does anybody know?
Gastrinoma.
It's
Yeah,
a
it's-
tumor that secretes
Gastric
More
acid.
acid.
Yeah.
Gastrin, so acid.
Okay. So it's just me.
Glad we're all on the same page now.
Okay.
Alright. Should we move on?
Alright, let's move on. No objections? Did we hit 7 minutes, Alan?
Let me think. I think we're past 7 minutes. We're 12.
12. Alright,
But we did hit 7 minutes.
not bad. Alright. I'll read again, unless anybody really wants to. Alright. Mr. Marvin Musty is a 52-year-old CEO of several large companies. He has a history of ADHD, but is otherwise healthy. He is in the clinic because of the past 4 weeks he has been having squeezing pain just above his belly button. Because of his job, he sleeps about 4 hours a day. He also smokes because he says it helps to reduce his appetite so he does not have to eat as much. His co-workers also feel he is much easier to get along with when he smokes at least a pack of cigarettes a day. He has been smoking a pack of cigarettes a year for 20 years. He has several children from different marriages. He exercises about 4 times a week, playing 2 hours of racquetball with his best friend Marcus. Because of pain in his right elbow and shoulder from racquetball, he was prescribed naproxen 6 months ago, which he has been taking regularly. He initially had only burning pain above the umbilicus that was occasional, but for the past month, the pain has become more frequent and is associated with non-bloody vomiting about 1 to 2 times a day. Do you think he should smoke more? He was advised by his Aunt Misty to drink a tablespoon of apple cider vinegar 4 times a day. Mr. Musty says this has helped reduce his pain from a 10 out of 10 to about an 8 out of 10. The pain does not travel to any other locations. The pain seems to worsen about 45 minutes after meals, and he has woken up at midnight on several occasions because of the pain. His family history is significant for congestive heart failure in his father, who is 80, and hypertension in his mother, who is 75. His uncle Melvin died of a myocardial infarction in his mid-40s. His review of systems is negative for headaches, vision changes, changes in taste or smell, muscle weakness, shortness of breath, coughing, rashes. His review of systems is positive for fatigue over the past 2 weeks. On exam, his vital signs are 98.7 degrees Fahrenheit, 130/80, heart rate is 90, respiratory rate is 14. His heat exam shows a pale conjunctiva and no neck masses. Heart is a regular rate with no murmurs. Lungs have equal air exchange in all lung fields with no crackle, bronchi, or wheezing. His abdomen is non-distended with active bowel sounds, and it is tender between the xiphoid process and the umbilicus. So we learned that would be epigastric or umbilical. His nail beds are pale. Towards the end of his visit with you, he asks if he should increase his apple cider vinegar. After reviewing your differential diagnosis with Dr. Wright, he tells you, "Good job," and asks, "Should we order any tests? And does he need to be treated for anything?" Please complete this box before proceeding to the next part.
Yeah, let's take a scope down his throat. Do his stomach.
Okay. Well, the naproxen does cause stomach ulcers, but he said that he had. Oh wait, he was prescribed naproxen 6 months, and then he's had the pain for 4 weeks.
Yeah, he hasn't been eating a lot. He's been taking apple cider vinegar and naproxen. So
It's like a
lot
long-term
of
side
stomach
effect.
acid.
So it's like, maybe
Yeah,
that's
probably
why it's
longer
like
than
a
6
4
weeks. But
6
Yeah.
months? Is it longer? 6 months is a long
No, I'm
time.
saying it's longer,
Yeah,
but
yeah.
that's why it's like
Yeah.
only coming
Yeah.
up now.
I think
Yeah.
potentially he could also have well, he has anemia, but potentially he might have cardiac issues due to family history, and then also like the smoking and stuff. But we don't know that yet. So I just put the inflammatory idiopathic. I don't think infectious necessarily makes sense. But maybe, I don't know about anything else to put for that. Because we don't have any other details really that would suggest a different
Pale
anemia.
Oh, from the ulcer.
I think he
Yeah.
has,
Oh,
he has
okay.
melena in the next
Oh,
one.
I was like, wow, what is that?
No, they don't. Yeah, they
yeah,
will tell us
that
that
would make
later.
a lot of sense.
Yep. I think one of his ulcers also ruptures.
Iron
Dang.
But we don't know that he has
Spoiled
ulcers
the
yet.
What?
Well,
We don't know that he has ulcers yet.
No.
Okay. But do you think, are we good with this
Yeah,
section?
that looks good.
Looks
Yeah.
good.
Yeah,
we got
yeah.
that.
Okay. Part 3. Ooh,
Okay.
that's not what I wanted to see.
2 weeks later, you are back in Dr. Wright's office. Overnight, Dr. Wright had 25 pages from patients. The 20th call at 3 a.m. was from Mr. Musty, stating that his pain is an 11 out of 10, and he also has pain towards his back. Since he did not
Oh no.
Since
Oh,
he
buddy.
did not
Oh, boy.
feel the medication he was prescribed as helping. Oh, there's a aberrant comma. Since he did not feel the medication he was prescribed was helping, he decided to increase the apple cider vinegar to half a cup 5 times a day.
5 times,
Oh,
good
that's-
lord.
The pain is now
Genius.
constant with
Do we think that he
associated
is
ongoing nausea
acidotic
and
now?
vomiting.
Ugh.
So a learning issue is like, what does apple cider vinegar do to the stomach in such high quantities?
I don't know, it's acid.
Dr. Wright asked Mr. Musty to have an x-ray in the morning. Mr. Musty also texted Dr. Wright with a picture of the stool he had earlier in the day that stuck to the side of the toilet bowl and had to be scraped off with a dinner fork.
Posted on his
Oh.
Instagram.
And a picture of the stool he usually has on the right, which is posted on his Instagram
Huh?
page.
Good
Why?
Lord.
Ew.
Um,
God, okay.
that's the melena, huh?
Yeah.
It is
Yeah.
11:30 a.m. in a busy clinic morning. Dr.
does
Wright
he have
has
a
not
second
reviewed
result?
his morning test results yet and asks you to start looking at lab results and x-ray. You come across
I don't think we
Mr.
can put
Musty's
that, though.
x-ray below. You think to yourself, what are those dark areas under the diaphragm? Should I go to noon conference or interrupt Dr. Wright from the patient he is seeing?
Should we put toxic environmental for this schema because this man is drinking an obscene amount of apple cider
Something
vinegar?
is toxic environmental.
So who thinks you should go to noon conference?
Oh.
I think this would make an interesting presentation at noon conference.
What is it?
Probably interrupt Dr. Wright.
But I think he needs to be treated for whatever is causing the pneumoperineum.
Isn't it more concerning that the stool he usually has looks worse than the stool he is currently having?
Yeah, that's
Wait,
what I was
where's
like, what's the one that he's currently having?
He's currently having the one on the left, and he said that the usual is the one on the right, but the one on the right looks
wait.
worse.
It's because of all this apple cider vinegar he doesn't eat.
I think they got those flipped because
I thought
they're
so.
saying that the
Yeah, I think it's flipped too. That's
the
what
one
I'm
that he had today was the one he had to scrape off with
Scrape
a
off.
fork.
Why is he scraping it off with the fork?
Ew,
though?
that
Wait.
is so
I have
gross.
so
Is that
many
supposed to be
questions
blood?
for this
Because
guy.
it smells like blood.
Um,
Wait, I think you're right. They are
Clean it using
flipped.
other things.
Because this one doesn't look like that.
No, you're not scraping
Bad.
that off with a fork.
Not
But also,
The one on the right is like
toilet
scrape off,
brushes.
right?
Yeah, I think they
Yeah, toilet brush.
Like,
Ew.
there are tools for this.
Like a
I think the normal stool is on the left.
Yeah, that looks a lot more normal. Also, where did they get these images from?
His Instagram page.
Oh, hey, they've got this nice. Did anyone look at these abdominal pain charts?
Yeah, but we don't need to put any differentials yet.
Yeah, no, I'm
so
just
like,
curious. I keep missing them. Peptic ulcer disease, gastritis, esophageal rupture, biliary colic. Yeah, pain towards the back is like ulcer rupture,
Is it
perforation. Nausea and vomiting.
Is this H. pylori?
Unknown vomiting. Melanoma. Pneumoperitoneum. How urgent is a pneumoperitoneum?
I would say relatively.
Urgent,
Yes,
probably.
I think to
But I wanna
interrupt
know
him in the
exactly
meeting.
how urgent.
But it sounds good.
Oh, shoot, yeah.
Yeah.
I think so. It's not helping his.
Yeah, I should put it is a problem.
It is a surgical emergency.
I think we're gonna interrupt them.
No, we have
It's
to
not
go.
from, like, a
We
bowel
have to go to
perforation
news
or
conference.
Shadow's hitting 7 minutes.
So we're at 23 in total, but we're 11 since we last checked him.
Okay, cool.
So we're definitely good to go. All right, I'll read number 4. 4 weeks later, Mrs. Hernandez undergoes her
We're back to
EGD.
Mrs. Hernandez.
Yeah, with the findings shown below. A sample of the gastric biopsy is placed in a rapid urease test, which turned positive. Dr. Wright prescribes treatment for her condition. Mr. Hernandez still insists on not getting the procedure. He asks Dr. Wright if he can just be treated for what his wife has. Dr. Wright tells Mr. Hernandez, well, I think we have 3 or 4 options here. Oh, there's the ulcer.
This is a different from the one people.
Oh, this is Mrs. Hernandez.
Yeah.
So that is,
Well, if it's H. pylori, then I guess we just need to know what the treatment is. Yes.
oh, you do, I forgot.
What's the
Antibiotics plus a PPI. But there's no 100% cure rate.
I just know it comes back a lot.
in the picture? What's the yellow circle?
Yeah, I was just wondering that too.
Is that like just any sign of each bone?
Well, don't they cause ulcers as well, though?
Or maybe that's where the biopsy was taken from.
Is this her
Could be.
lower? Is that a sphincter or whatever?
Yeah. It
Is
looks
that her
like
soft?
That's like
That
near
is-
the-
What is that?
the-
Yeah, I don't even know what that is.
I think that's gastroduodenal junction. No, it's not.
no, the Z line is different.
Okay, Mary, what is it?
Is this the
I feel like that's just like the
Inside the stomach?
yeah, or like
Probably.
one
Maybe
of
it is
the
in the stomach.
sphincters for it. But I'm assuming
Oh, we
that
got two.
the yellow circle is just where the
It just
biopsy was taken from because it looks like something got like pinched out of there.
That's not the ulcer or an ulcer.
Well, did we say that she had an ulcer?
Maybe this is the stomach. Probably the stomach.
Oh, she.
Gastric biopsy.
Because hers was the
Oh, they all look the same.
It's nausea and heartburn. Felt full easily after she started eating.
Depressive erosions? Do you think it's a depressive erosion? Multiple white and flat elevated lesions. Is it a? It looks white.
so
Yeah.
then maybe
It looks
that is
flat.
the ulcer.
It's an
I
ulcer?
guess.
Does it look elevated?
It looks like an ulcer.
Yeah.
Yeah, I think it's an ulcer.
The bacteria is eating the stomach tissue.
That's
No. Or if I have an ulcer.
Okay.
Sure I have one in college.
Are we done with
Probably.
this?
Yeah.
I take so much Advil.
I can read part 5. It has been 5 years since you last saw Mr. and Mrs. Hernandez. I'm just confused about why this switches between the different patients. But okay. You're in your second year of residency and working in the ED with Dr. Daniel Underwood. Your 12th patient after being in the ED for 3 hours is Mr. Hernandez. The same Mr. Hernandez you saw a few years ago. You find Mr. and Mrs. Hernandez in ED room 50L. Mrs. Hernandez insisted Mr. Hernandez went to the ED because his pain has become very severe. Since you last saw him, Mr. Hernandez decided to buy some of the medications you prescribed to Mrs. Hernandez over the counter. Can't he do that? He even doubled the amount you had prescribed to Mrs. Hernandez. His pain improved somewhat to being bearable most of the time, but never went away. His pain is still above the belly button, but has become more severe and more constant. This has been 5 years. He has also been feeling very tired over the past 4 to 6 weeks. He has lost 15 pounds over the past 6 months. His pants keep falling off because he has thinned out. He is constantly nauseated and the last 2 weeks had 2 episodes of vomiting with clots of red mucus. On exam, he is curled in a fetal position. His sclera is white and his conjunctiva is white. He screams in pain when you press on his epigastric area. You review his labs and find that his hemoglobin is 7 grams per deciliter and his ESR is 100 millimeters per hour. His ALT, bilirubin, albumin, and INR are normal. You contact Dr. Kendrick Chi, who agrees to do an emergent endoscopy with the following endoscopic findings. After the endoscopy, Dr. Chi admits Mr. Hernandez and explains to him the diagnosis. Using a shared decision-making model, he agrees to have Dr. Gomez do a laparoscopic procedure. The outcome of the procedure is shown below. Okay. I don't know what we're-
Are they like ligating some like bleed? What are they doing?
I can't. This is not a great
This
picture.
is the outcome.
This is the outcome? It looks like they're still in the procedure. Okay.
Wait, did they? Huh?
Was it a perforation? Is it endoscopy? How did they get in there?
Oh, it's,
No,
they-
this
they
is
did
a laparoscopic
Oh,
procedure.
and then
They like went through the
stomach.
Tummy.
abdomen like this, and then
In the problem list, can we also put
It should.
unprescribed antibiotic?
yeah.
Well,
It looks like
Where
they
are you gonna
resected
get
something
those
out of
from?
the stomach, right?
I don't know how you can
Was it a
get
tumor or
those.
something?
Was it pancreas?
Just do like surgery.
That's
The only thing her endoscopy showed was H. pylori.
The inside.
Yeah, but you
Where it
have
came
to
from.
use
Yeah, I wonder.
antibiotics and
Is that what,
protein
is it a
couplers.
gastric?
So how does
Oh, did they? They might have.
how do you
removed
get
stomach.
those over the counter without a prescription? That doesn't make any sense to me.
Because I looked at
I think they
the
did
over the
remove
counter
stomach,
treatments
right?
and it's all like it's
I was like, I
probiotics,
don't
green
think
tea,
there's-
honey, like it's
Yeah.
all very benign stuff, I guess.
Yeah.
It's not really
It
medication.
should be over on the.
Was it
on the right?
Was it a gastronoma?
Do we know what these endoscopic findings are? Can we reverse
Blood and
I was-
inflammation.
Does he have a?
It's a gastrectomy. They just took the stomach out.
That's probably his stomach. The endoscopy is his stomach.
extreme
You're right. It was
It was
gastronoma. Maybe.
caused by or like because of the ulcer?
Because of the chewing tobacco, maybe?
Oh.
Yeah, because of everything. Because of the apple cider vinegar.
No, he's not the one drinking.
Oh,
apple
shoot.
cider vinegar.
Oh my
Such a
goodness,
low
it's different
quality
people.
picture of
Well, it's
this.
musty. That's musty. That's
I
musty.
get such a low quality picture of this.
Oh my gosh, what does it say?
That there's a gastric remnant.
It's switching back and
Huh.
forth between the patients
I'm getting
because it's a
confused.
compare and contrast learning model, like we learned
Wow.
for our last SEQ.
Wow.
Remember?
Wow.
A lot of thought went
Picture,
into this.
that picture is a picture
This is
of a
helping
gas.
you learn, Mary.
Gastrectomy? Like they took out the stomach?
The bottom picture I think is
Yeah, the bottom
Well
picture,
thought
yeah.
out.
like the
Okay.
yes, that
Uh-huh,
one.
yeah.
Wait, do we? Is it
So why did they
cancer?
take out the
Yeah,
stomach?
it
Is
looks
it
like
cancer?
cancer.
Stomach
It
cancer?
looks really.
Okay,
So
so
Cancer,
what were those
Septic
yellow
Bleeding, pain.
the last things that
Weight loss?
Yeah.
Yeah.
The weight loss is
the,
significant.
wait, the last thing that we have to do
Elevated
is come up with 3 differentials for each person.
Okay.
So Mr. Hernandez, we think it's
Gastronoma.
gastronoma.
Gastric.
Mrs. Hernandez, we put no. That's Mrs. Hernandez, Alan.
Well,
Okay.
one of the photos that he had for Mr. Hernandez was gastric adenocarcinoma.
So Mrs. Hernandez was peptic ulcers.
What about H. pylori?
So I'll put
Well,
that there.
H. pylori can
Yeah.
be H. pylori
Can cause a
can
peptic ulcer.
cause. So I guess
Yeah.
maybe peptic ulcers could be the second diagnosis. H. pylori is the first.
You could say like NSAID-induced peptic ulcer in the first one.
Doesn't H. pylori cause cancer?
H.
It can cause
pylori.
gastric
disease, peptic
adenocarcinoma.
ulcer.
That would be a
Or
great
just H.
learning
pylori
issue.
infection.
I forget.
I never tried to do that. Yeah.
Oh, like secondary to.
Yeah.
Three most
You
likely.
could say peptic ulcer
Peptic
secondary to
ulcers.
H.
Yeah.
pylori infection.
I guess it affects everything.
H. pylori infection.
Can I
you
do,
want that
does
as a
it cause
differential?
cancer for learning issue?
Yeah.
I mean, she's really got H. pylori, right? So the urinary.
Yeah, she does.
She has H.
We know that for
pylori.
sure.
I mean, and then you could put gastric ulcer secondary to H. pylori.
But she like she has.
How about like
that.
gastritis, just like from
Because
pernicious anemia?
what her scope showed was just like
Wait,
the
why did they
H.
say
pylori
it's not
findings.
like
Like
the
that
CE, zolinite?
Oh, like all
Stone
the
appearance.
That
cloud
can be
kind of
caused
thing.
from
Yeah.
like gastronoma.
Okay.
That is gastronoma. But
Yeah.
why did they say it's not zolinite?
No, they didn't say they're not. They just said
Maybe
they don't
just 'cause it's
suspect
not
it.
common? I don't know.
if we're putting that as like our number one differential.
It's rare.
Okay, we can put gastritis for the third differential for her. I don't think it's really.
I feel like we should put gastric adenocarcinoma first as number one.
Wait,
For who?
For Mr. Hernandez.
Oh.
Yeah, but we're
Yes.
doing Mrs. Hernandez.
Oh, crap.
Oh.
I'm so sorry.
Alright, let's do
No,
one at a time.
this is Josh. You were on Mr. Hernandez's though, so you want to put gastric
I feel
adenocarcinoma
like
as
that's
the first one.
Just because
I
they
think,
said it's
um,
not neuroendocrine or
what?
something.
I think
Okay.
Zollinger's like the result of the gastronoma making like extra gastric. And
I thought Zollinger was
What do we
type
want
of
to put
gastronoma.
as 2 and 3 for?
I think the
Okay,
manifestations,
manifestation.
like the consequences of
My
having that tumor
space
making
bar
gastric.
keeps on like sticking.
So it's basically
I'm
the
like,
same.
I don't know if it's because there's something underneath
maybe.
there, you know.
I don't know.
Should bring it to the Genius Bar and have them
No.
fix it for you.
No.
They've got all the geniuses
Okay.
over there.
So we're still gonna put gosh.
Sure.
Yeah, I also think we should put the
Yeah,
Cancer
that's good.
for
And then the
Mr.
last one.
For Mrs. Hernandez, what do we want to put besides H. pylori? And do we want to just put gastric ulcers?
Did she take anything else? Like any meds? I forgot.
No, she was only taking a multivitamin. I mean, the doctor prescribed her something
Well, what's it do?
before, in between the time from her visit to the endoscopy.
Okay.
But I don't think any of that would really. Yeah, we can just put peptic ulcer disease.
Yeah, we should put that too.
I think that's fine. And then gastritis. And then, okay, we have the 3 for
Mr. Musty.
Mr. Hernandez. What is the difference between a gastric adenocarcinoma and a gastrinoma?
Well,
The
is it
gastrinoma
tumor?
secretes
Oh.
gastrin.
Oh, okay.
Yeah.
I think the adeno is like more common, I think.
Okay, so for Mr. Musty,
Mr.
Musty.
Musty.
peptic ulcer
Peptic
disease
ulcer.
also. What?
I already
It seems
forgot.
like
Okay, wait,
the
musty was the
ulcer
apple
one,
cider
like-
vinegar.
Yeah,
apple cider
vinegar.
Alright, alright.
Musty.
Maybe cancer.
Yeah.
Like a colon
Well,
cancer.
because
yeah.
he also had the
Yeah,
melanoma.
melanoma.
The
Right,
melanoma,
so
yeah.
we
Like colon
could put-
cancer, yeah.
Colon cancer.
Yeah,
You wanna
colon
roll that out.
cancer,
I think we should put that.
peptic ulcer disease.
Crohn's disease.
Yeah.
Do we want
Or
ulcers
Crohn's.
first or colon cancer
I
first?
think ulcers, because if you like do the abdominal pain
Yeah.
thing that they
Oh,
give
yeah.
you, epigastric is like peptic ulcer
Yeah,
disease.
and the X-ray.
Yeah,
Like, do we say perforated?
the
Perforated ulcer.
Yeah.
Okay. Oh, because of the air in his the X-ray.
We just need like one more for him, yes?
Yes.
What else is
Mr. Musty.
For Mr. Must?
Yeah.
For Mr. Must.
What about like
Oh,
Can we
drinking
put
too much
perforated-
apple cider
Can
vinegar.
Can we
like
put
bore a
perforated
hole?
ulcer as, or is that no?
Is that just the ulcer, like, that makes a
That's-
hole through the
Like the
lining?
pneumopert.
Like it perforates, like the ulcer is so bad that it goes through all the tissue layers, right?
Because that's also on the, well, because he has the pain spreading to the back. So I guess we could put perforated
Pancreatitis.
ulcer due to, like, secondary to peptic ulcer disease? Yes?
Yeah, or just say perforated ulcer.
wait as another?
As a
Oh.
different,
Oh.
and then do we want to just put peptic ulcer disease as a secondary, as a
Pretty much the
second
same,
diagnosis?
though.
What about?
Because I feel like it's just progressed to a perforated ulcer.
Why don't we say, wait.
I don't know how we want to put that though.
Yeah, because the X-ray's kind of like specific. I mean,
I think something else that can cause like colon
The
or
air.
melanoma.
oh,
Or
melanoma.
Melanoma.
Is diversity
Not
It's
hemorrhoid,
like
that would be bright.
esophageal varices,
Diverticulitis.
rupture, like cancer, severe
Twisted
inflammation, stomach lining erosion.
I think we should just choose one of these kind of things. Like just something
Okay.
else that can cause.
We could just do what? Did we put gastritis for him?
I think.
We can put
Well,
gastritis.
Right.
We can just put gastritis.
Can an ulcer cause, like perforated ulcer cause gastritis too?
Yeah.
I'm pretty sure.
But we
Gastritis.
put perforated ulcer secondary to
Yeah,
peptic
yeah.
ulcer disease. So then, and then gastritis can just be the third.
Yeah, that's.
And then
fine.
we're done.
Yay.
We're done.
What?
Is that it?
Oh
yeah,
yeah.
because then we
Oh.
just have to. That was the only thing on the PIQ session
Oh,
one.
nice.
It was just this document.
Great.
Okay.
Yeah.
Do we just have
So then we just have to assign ourselves to certain. Which honestly, we put peptic ulcer disease for like all of them. So. And we put
That's
gastritis
true.
twice. So I think each of us will probably only have
Just
like
one.
one thing.
I'll do the adenocarcinoma. Oh,
Oh,
like
no,
joint
you
of-
can
I'll
have
okay.
all
do,
yours.
I'll do gastritis.
Adenocarcinoma.
I'll do whatever Aaron wants.
You want to do you want to do colon cancer, Alan?
Sure.
Sorry.
Can you write it down in the chat?
Yeah, I'm
Someone
putting
needs to
it.
do
Peptic ulcer disease. Oh wait,
Quinn.
Josh put
I think
that.
Josh.
Oh, Josh.
Oh, never
So-
mind.
Yeah,
Do you
so
wanna do it
Quinn, you
together?
could you could just do
The
the
ulcer.
perforated
Perforated, yeah.
ulcer,
Okay.
and then like Josh is mostly gonna do
Just the ulcer.
peptic ulcer disease. So you'll just be doing like the perforated ulcer. Okay, perfect.
Beautiful. Go team.
Go to work, guys.